You woke up this morning, and if you're like most people, your knees might be aching. Maybe yesterday you had an awesome workout and your muscles are sore. Those squats of 400-pound weights got you really aching. And that body just, it needs a jolt of something. Well, today we have something brand new for you. It's called Halo Cryotherapy. And so that's where we're at today with Jack Youngren in Edina and his shop called Halo Cryotherapy. And I think you guys are going to love it. Jack, thanks for being on today, man.
Yeah, absolutely. Thanks for having me. You're speaking my language.
Yeah, exactly. We all wake up with some aches and pains,
Right.
don't we?
Absolutely.
I don't care how old you are. But today we're going to learn a little bit about basically going into a nitrogen bath, which not only does it look cool,
Yeah.
but it kind of sounds cool.
Yeah, absolutely.
So
Pretty cutting
tell us
edge.
a little bit about that.
Yeah, for
I
sure.
mean, how do you land on something like this?
Oh, man. So I got into it because I was running marathons. I was training. I was waking up sore, like you were describing. But I loved it, and it was something I was passionate about. And I was a football player in high school, and I woke up sore and stiff, and I needed to get back and ready for that next training session or that next practice. And
back then, like we talked about, didn't you jump into that big ice bath?
Big old bucket of ice water.
Yeah, and you're like, oh, this
hated
sucks.
every minute of it, man. I hated it. And now I had a buddy that started something with cryotherapy in the Twin Cities, and he reached out to me, and I was like, yeah, I want to try it. So I went in, and 3 minutes later, I come out of this extremely cold machine, and I feel great. And I'm like, how is this happening?
And how long ago was that?
That was about 4 years ago.
Oh, wow.
Yeah. So 4 years later, here we are. But I got into it because I needed to recover faster, and I needed less aches and pains, and I was sick of the ice tub. So
What were you thinking? I mean, it's your buddy calls you up. He
Yeah.
says, hey, you got to come over here and try this out.
Yeah.
I mean, what were you thinking?
I was thinking it sounds extremely cold. He was like negative 250 degrees, and I said, I don't know if that's physically possible. And he had me come in and just check it out, showed me the machines, kind of like we were doing a couple of minutes ago, and just seeing how it works and what it looks like, and trying to wrap my head around it. And before you knew it, I was in there going through it.
And when you saw the machine, what were you thinking?
I thought it looked like a spaceship.
Right?
Yeah.
That's what I said too.
Yeah, it looks like a standing tanning bed that you could fly through outer space in. Yeah.
That's cool.
But it's a really cool process.
So when you got in the machine, I mean, what did it feel like?
It feels like you're walking outside to your mailbox in your underwear, kind of. It's not windy or cold. It's a completely different feeling. You hear those numbers, negative 250 degrees, and it's intimidating, and it creates some anxiety, and it's hard to wrap your head around, but it's completely different while you're in there than what you would imagine it being. It's a completely external cold, and it's not as unbearable as an ice bath is. It's a lot easier than an ice bath.
So when you did it your first time, you
Yeah.
got out of there, and how did you get hooked? I mean, what were you thinking? What were you feeling?
Yeah, so I immediately felt this huge blood flow that just went from my core out to the extremities. I felt alive, very, very alive. You get this big endorphin release. It's like that runner's high, or that high you get after a big workout, where everything feels good, your blood's pumping, and your heart just feels like you're a kid again. And that's how I felt when I got out of there. I was like, I've never felt anything like this before. And I was hooked immediately. And so I wanted any part of it that I could. So I got a job. I asked for a job.
You're like, give me the job. I'm in, man.
Yeah, what can I do for you? Sign me up.
I need this every day.
Yeah,
I got to get in here every day.
Exactly. And so I started working with them and learning as much as I could. And that was something that I wanted to do because, I went to school for physical education, kinesiology, and I love how the body works. I love figuring out how my body works versus somebody else's. Everybody's got their own situations, and every body is different. and trying to find out how something like this can affect everybody that walks through the door. And it's been a really cool process learning that and translating it into my background and my education has been a really cool process.
So you got a job now.
Yeah.
So for sure you're going in there every day.
Right.
You're like, dude, thanks for hooking me up.
Right.
Okay. So
Perfect.
now, but again, like you said, you're not just doing it because you want to learn or recover yourself.
Yep.
You're starting to realize, and you kind of talked about this before we got on, you're starting to realize, wow, look at how it can help other people.
Right.
So talk a little bit about that experience as you're, working there.
Yep.
What are you seeing that really got you hooked? Because now today, I mean, you're running the show. So you had to not only fall in love when you got in there, but you had to fall in love with it as you see it help other people. So walk us through that a little bit.
Right, yeah. So that's a great question. I've seen some really, really cool things. The first time that I really saw how it can extremely change people's lives, a young gal came in as a hockey player. She had a hip injury, and she needed labrum surgery, which is a big deal for a 16, 17-year-old body. And so she used cryotherapy for pre- and post-surgical protocol. So before she had surgery, for about a month, she did cryotherapy on a regular basis, and it helped to decrease inflammation and swelling in the injury site. And what that does is that it gives the surgeon a very clean workspace so that they're able to work in that area without worrying about swelling and different things like that. And then afterwards, she came in right away when she was able to stand in the machine. She got in with a crutch, and she was able to stand on two legs in there.
Wow.
And decreased pain, increased anti-inflammatory proteins in the bloodstream to help with the healing process. And that blood flow really, really helps with the healing process. It's an amazing thing. I've seen that with that hip surgery. I've seen it with cosmetic surgeries. I've seen it with other back surgeries, tons of different things like that. But that young gal coming in there and seeing how it can help her body to recover faster was an amazing thing. And it kind of opened my eyes to, okay, I got to see more of this, and I got to help as many people as possible.
And why is that so important to you? You know what I mean? Because a lot of people look at me first, and then maybe I'll help somebody else. But
Right.
I can tell, just talking to you today, you're really about, helping people.
Right.
Why is that so important to you?
I think that through what I've kind of been through in my life and my experiences, people have helped me so much that it kind of turned my focus to giving back what's been given so freely to me. So that's just kind of what my structure and belief system is, because I feel that you can walk through life and be focused on yourself all day, but you're really gonna benefit from changing your focus to other people and helping other people, and that's what helps me, what drives me on a daily basis.
That's cool, man.
Yeah.
So do you have any other stories that, something else along the way, or while you've been here at Halo Cryotherapy that just blew you away, or a story that just blew you away about how this has helped somebody?
Yeah, absolutely. So cryotherapy was created by a rheumatologist for rheumatoid arthritis patients. And the first rheumatoid arthritis story that I had was of a middle-aged gal. She came in and she struggled mightily with her symptoms of her RA. It was ravaging her body. Couldn't grip a steering wheel to drive around. She was taking prednisone when she had flare-ups, and prednisone's hard on the body. All those injections and different medications. She'd be on a medication for a while, and then it would stop working, and her body and the RA kind of figured that out. And so then she'd have to change meds, and it was a real hard process for her. She's like, I can't do the things that I used to be able to do. Exercise. I can't, walk my dog at the end of the day. I can't do the things that I want to do. And by coming and doing cryotherapy on a daily basis, she got off all of her meds.
No way.
She didn't have to take prednisone. She started working out again. She was able to, do the things that she wanted to do, which is really cool. I mean, I just remember so you take like a vector score of the RA in your body, and she came in with something like a 46, and she, after a year of cryotherapy, her numbers were down in the teens.
So 46 out of what, 100?
46 is just a kind of a scale. Yeah, it's out of, I think, 100.
Okay.
Yeah.
So 46 out of 100,
yeah.
let's say, unofficially.
Right. Yeah.
And then she went from that all the way down to like a 13 or something?
17.
17.
Yeah.
Wow. Yeah. I mean, that's like getting your life back.
Right. And I mean, it just changes her whole outlook on life. So those are really cool stories to see, and they become part of our community and our family because you see them every day. You know, you see these people every day. You know, some days they come in bumming, some days they really need you. And some days they come in on the top of the world on cloud 9. They're bringing you cookies because they appreciate what you're doing for them. You know, they're just part of who we associate with. They become one of us.
Man, that's awesome, Jack. You know, I can really see how you can get addicted to being a part of all that.
Yeah.
And, you know, I was thinking to myself before I came in, and really the way I summed it up was that, you know, you guys believe that the human body can overcome any obstacle thrown its way. All it needs is a little help, and a miracle can happen.
Right.
And maybe the cryotherapy is the little help that you're giving people.
Yeah, we're giving the body a little bit of a boost. Our body has an automatic response to extreme cold temperatures, and it's built in. And all that we're doing is we're giving that boost, as you said, or that we're tapping into that resource. It only takes a couple of minutes, and the body does the rest of the work for you. So whether you're a youth athlete or you're an elite athlete that needs a little bit more recovery, you know, like some of the Viking guys, like we were talking about a little bit earlier, or you have an inflammatory condition like one of our everyday guys that had Crohn's disease. You know, those are things that we're able to help our body to attack. We don't want those inflictions to attack us anymore. We want to help our body to attack it. So
cool. So I kind of want to sum up because this is, I mean, I knew nothing about this coming in today, and I still don't know if I understand it completely, right?
It's all good.
But basically, with the use of extreme cold, you're triggering your body's natural responses, increasing blood flow, and releasing hormones that help the body heal, right? Yes. So walk us through the science of that, because I think people are, especially our listeners, are really going to be curious to understand that.
Right. Yeah, so it's a pretty simple process. What we're using is nitrogen vapor. Nitrogen in its purest form is an extremely cold element. So we use nitrogen vapor to surround the body and alert an emergency receptor in the skin. I'm only cooling our clients' skin temperature. I'm not dropping your core temp and causing hypothermia. I'm only affecting your skin temperature, and the body does the rest of the work for us. So what happens after we're exposed to that cold is that, first off, our body says, whoa, something's going on, and it releases endorphins right away. First thing, we get this huge rush of endorphins. Nice. And those endorphins make us feel really good. They give us that runner's high. It's our body's natural painkiller, so if you come in with aches and pains, those are alleviated right away. So that's the first thing that happens is endorphins are awesome. Yeah. And our blood vessels in our skin close while we're in there to protect our vital organs. That's part of the body saying, whoa, something's going on. So it sends all that blood to our core to protect the vital organs. And when we step out, we get vasodilation of all the blood vessels throughout the body. Those blood vessels expand, and all that blood from our core that was picking up oxygen and enzymes and proteins rushes out to the extremities, to the muscle tissue, flushes out toxins in the blood, and flushes out inflammation in the joints to help with those achy joints that you were talking about a little bit when we wake up in the morning. So that vigorous blood flow helps with a ton of different parts of the body's, the healing process. And there are cytokines in our bloodstream, and they have a huge part in our inflammatory response. There are pro-inflammatory cytokines that respond to exercise or to inflammatory conditions. Those create inflammation. And there are anti-inflammatory cytokines that fight inflammation for us. Well, right now, as we're walking around in everyday life, we have way more pro-inflammatory cytokines than we have anti-inflammatory. So what cryotherapy is able to do is it's able to increase our anti-inflammatory cytokine levels, so that as our body tries to build inflammation, those anti-inflammatory cytokines are knocking it down. So we're even in the playing field between those cytokine levels so that we don't become so inflamed, and we're able to skip some of that inflammatory response and go right into healing. So that's a big part of the puzzle for us.
Wow, that's crazy. How many, I mean, I know this is going to vary, but how many times do I have to come in here every day? Can I come in once a week, once a month? I mean, what is that line of a treatment that is effective but yet not overkill?
Right. Great question. So the first 30 days is the most important. We all have systemic inflammation of some sort, whether we do have an inflammatory condition like RA or we're average Joes trying to exercise every once in a while to stay fit.
Right.
That inflammatory response is winning right now. So that first 30 days, we want to flip the inflammatory script. We want to get those anti-inflammatory proteins up. So I like to say about 10 to 12 times in that first 30 days, we come in and we do whole body cryotherapy, get that inflammatory response cooled down a little bit, and then we can, find a happy spot for us. I think the 1 to 2 times a week for most people is a good spot to be. If you're an elite athlete or someone that has an inflammatory condition, you might have to do that a little bit more than that. There's no boundary to how much you can do it. I have a lot of people that do it every day. Me, myself, I'm about 4 or 5 times a week just because I like it.
Right.
And it makes me feel good.
Yeah.
But everybody's different, and we're able to personalize that for everybody that walks through the door.
That's really cool. That's cool, man. So, you don't just have the full body treatment. You guys actually have the whole body treatment. You have a local cryotherapy, and then you also have a cryofacial.
Yes, sir.
I mean, you guys got it all covered here today.
Yeah.
So go into that a little bit. I think I was kind of astonished that you have a cryofacial.
Right. Yeah, so the cryofacial is really cool. It was created in the late 2000s, and it helps to boost collagen production and slow down the collagenase that breaks down our collagen in our skin. So we're using cold temperatures to address the head, face, and neck with a stream of nitrogen vapor. And what that does is that it increases blood flow to the skin, and it cools that surface of the skin so that our body creates new healthy skin cells.
Give us an example, because I'm just thinking, God, if my wife came in here, she would love this.
Yeah,
So why would somebody come in here instead of going and getting a full body facial?
Right.
Or, tell us a story about that. There's got to be plenty of ladies in Edina that said, I've been going to this place to get a massage and do this and that, and then I tried your place.
Yeah.
And wow, it feels like it's maybe healthier. I don't know.
Yeah. So it's completely non-invasive, for one. You can come in as is. It takes 10 to 12 minutes. And it gives you just this natural, healthy glow. I'm not putting anything on your skin. We're not using any chemicals. I'm not poking you with needles. And it helps the body to do what it's supposed to do naturally. We're not adding anything to the puzzle. The body is an amazing, amazing tool. And it can do incredible things if we just give it what it needs. So we're just back to that jumpstart kind of an idea that you were talking about, or that boost. We're using those cold temperatures to stimulate that healing process in the body. So a lot of people prefer it because we're not causing any peeling where you have to kind of hunker down for the next 3 days before a big event. You can come and do a cryofacial and then go to dinner or a big event that night and look great.
How does that happen? How does it do this to your face?
Yeah, so it takes the top layer of the skin and it replaces it with fresh, healthy skin cells. And it also increases blood flow so that you have that healthy glow to the skin. That's the first thing that people say, is that my skin looks more vibrant and it feels like I just washed it with like water from a fountain of youth. And it's visible to...
are you getting rid of wrinkles?
Yeah, you can.
Really?
The wrinkles, you need a little bit more time. You need to do it a little bit more of a regular basis to get that collagen production up. That's the slowest piece of the puzzle. And by slow, I mean like a month and a half of doing it once or twice a week. You're going to really reduce the appearance of wrinkles, sunspots, age spots.
Wow.
Yeah.
That's cool. That's cool. And then so the local, you like you said, you have some athletes that are coming in every once in a while. And local, being an athlete myself, I remember, obviously you put the ice pack on your leg, or you do the electroshock therapy and you put those patches on there and you're trying to get your quad or something like that. I mean, is that how you use the local, or, how do athletes take advantage of that?
Right. So the localized cryotherapy, we use the same machine that we use for the cryofacials, and it isolates an individual area of acute pain or inflammation. So we see a lot of ankle injuries, lower backs, shoulders, a lot of areas that have repetitious task issues. Tennis elbow is a good example. But say an athlete comes in with an ankle sprain, and they're swollen and they're bruised, and that blood flow is constricted from all that swelling and compression. So we use the localized cryotherapy to cool the surface of the skin, increase that blood flow, and send a message to the brain that says, hey, something's going on in this area and I need to address it. And the body does the rest for us. It's a really cool process, but we're not cooling the muscle tissue or the under the skin temperature like an ice compression would. That sends blood flow out of the area. What we're doing is we're bringing blood flow to the area to help with the healing process. Because if you're icing your quad, you're sending blood flow away, hoping that it comes back and does some
right.
good for you.
Yeah.
What we're doing is we're just saying, hey, this area, there's something going on here, and I need to figure it out. And so the body sends blood flow to the area, flushes all those toxins that are causing the inflammation and the swelling, gets that stagnant blood flow out, and helps with flushing out and healing process.
This is, it's so simple, but it's so cool.
Absolutely.
It's like using the body, and you're just a spark for the body to really stimulate a lot of different senses and hormones. But where is this going to go in the next 5 years? I mean, is this going to even get more in depth? Is there going to be a lot more ways to apply this technology or this? I mean, because this has been around for how long? So the Chinese or Japanese or something started it?
It's been around since 1978.
Yeah. So where's it going to go? Where do you think?
It's a good question. I think, the growth has been really, really rapid. When we got into it, there were less than 10 of us in the country, and now there's over 700 and counting, and they're popping up all over the place. And I think that it's only going to continue to grow because of its non-invasive nature. It's really quick and easy. You're only in here for 10 minutes unless you want to hang out. You're more than welcome to do so.
Like us today?
Yeah, right? But yeah, it's quick and easy. You don't need to bring anything. We've got everything you need for you. So I think that these places and the way that we're able to not worry about taking medications, we're not putting anything into the body. I think that that's the route that we're going with our health and wellness care right now. The insurance systems are kind of goofy for some people. People are struggling to find ways to feel better, and I think that we're a way that we can really help them out with that.
Well, that's awesome. And then, we always like to ask how we're big believers in giving back to the community. And I thought one thing that you had mentioned is that you're a big proponent of giving some of this cryotherapy to sports teams in the local areas. Tell us a little bit about that. I think that was cool.
Yeah, we love supporting our local sports teams. They work hard, they're practicing like crazy, and for me as a high school athlete, if I would have had something like this to try instead of that 50-gallon drum of ice water,
right?
I would have jumped on it. And for me and my dad, who also is here with us, we grew up as big sports kids. He was a coach, I was a coach. And so we know how much work goes into it. So supporting those local teams and basically giving them a bare bones price to just cover costs and get in here and get some team bonding. Nothing's more fun than laughing at your buddies in a cryo sauna. So it's a pretty cool way to bring them in and get them to do so. And just helping our local schools out. Whether it's a silent auction and donating our services to help them raise money. Things like that. We love being a part of the community. So,
well, I have to say, Jack, this has been one cool experience. So thanks for coming today.
Yeah, thank you. We appreciate having you.